So imagine this. You're driving down the road and it's a really stormy winter's day. You've got visibility of maybe 15 feet. And all of a sudden you can hear your pulse echoing, throbbing in your mind. And a few moments later you start seeing tunnel vision. You're completely blinded on the sides. So you pulled over, because at this point you're almost in the throes of an anxiety attack. And a few moments after you pull over, you're blind. You can see nothing. You can hear the rain outside, you can hear the cars driving by, but you can see nothing. This is just one example of how debilitating a migraine can be. Migraines, in order to understand migraines, you first need to understand the difference between a migraine and a headache. A headache is just that, pain within your head. The Migraine Trust, which is a research funding charity based out of England, states that headaches vary greatly in duration, cause, and severity. Headaches are very common and have causes ranging from side effects of medication to hangovers. Migraines are different. Migraines are moderate to severe in pain and are usually unilateral, meaning occurring on one side of the head. Symptoms of migraines can include severe pain, sensitivity to light and sound, and nausea and vomiting. But there can also be neurological symptoms accompanied with it: yawning, chills, fatigue, increased urination, and sweating. Now there are two types of migraines. There's migraines with auras and ones without. An aura is the presence of neurological symptoms. The National Institute of Neurological Disorders and Stroke state that the visual disturbances can come in the form of zigzag lines, flashing lights, temporary loss of vision, tunnel vision, and severe eye pain. Although the exact cause of migraines are unknown, it's thought that genetics play a role in predisposition. Doctors once believed that migraines were caused by the narrowing and opening of blood vessels, but according to the United States National Library of Medicine, experts now believe that it has more to do with the nerves in the head and the chemicals that they react with. There are different triggers for migraines. These include, but are not limited to, anxiety, stress, lack of sleep, improper diet, and hormonal changes, especially in women. But there is hope. As of right now, most treatments are medications for migraines. And migraine medication is great and cuts down on the length of the duration of the migraine, except there's no long-term solution with these medications. In 2010, in June of 2010, the FDA approved Botox as treatment for chronic migraines. Chronic migraines are migraines that occur on 15 or more days per month. Research published by the Journal of Headache and Pain found that those who got injections of Botox showed a decrease in number of days by around 50%. There's also a study that was conducted at Harvard Medical School, one of their teaching hospitals, and they showed with the use of narrowband green light that there was a decrease in 20% of the pain severity. And they found that out because inadvertently, during other research, they found that blue light increased pain, even in blind patients. I would like to end with this and give you a little bit of homework. If you go home and go onto YouTube.com and type in the Excedrin, the migraine experience, the makers of Excedrin actually funded a project where they took visual stimulation and created the experience of a migraine for a loved one. You can find that again on YouTube.com. Thank you very much.